It's unclear as to why some patients get colon cancer and some people do not. We think that there are a number of genetic mutations that need to occur that take normal colon tissue and turn it into a polyp. And then that polyp needs other genetic mutations to grow further. And then there are other genetic mutations that then come along and turn that polyp into a cancer. This process takes perhaps 6 to 10 years in some cases. It may happen earlier in others. Some of the reasons that this occurs is from inflammation. Patients with ulcerative colitis and Crohn's disease, due to their inflammation, have a much higher risk of developing colon cancer than the average person. We also think that some people are genetically predisposed to developing colon cancer because of genetic mutations that they may have been born with.
A colonoscopy can be a very daunting experience, but it's actually something that's very easy, and once we do it, you do it right, you don't actually have to do it for maybe 7 to 10 years. So it's something that every patient should get screened for once they turn 50.
Everyone from their 50th birthday should have a colonoscopy. We know that that's helpful and the good time point to do it. But we all know people younger and older who've gotten colon cancer. So younger, right? So we know African Americans should be screened at age 45. That's what their guidelines suggest. And so we recommend earlier. If you've had someone in the family with colon cancer, the recommendation is for you to get screened 10 years before their colon cancer was diagnosed, just to make sure you're in good shape there. Once you've had your 50th birthday present of the colonoscopy, while the guidelines vary a little bit, we think at least every 10 years subsequent to that. What's being looked at is the role of stool testing, so sending an annual stool sample to the doc to have that tested. Those tests have improved in quality, and we know that they too add to the overall benefit of screening. Easier, cheaper test that could be done on an annual basis. So most patients who are diagnosed with colon cancer aren't symptomatic, although many do present with bleeding, bowel obstruction, and pain. So we do want people to pay attention to their bowels and to their abdominal symptoms, and if they have new symptoms like that, to be screened. You know, when people come up and ask me, do I really have to get a colonoscopy? I wonder if they think I have some sort of Dr. Spock tricorder, or I can just tell, oh no, you're fine. You don't need one, but you need one. I don't have that tricorder. Get screened.